Welcome, everyone. I'm Dr. Luann Fortune with Saybrook University in the Department of Mind-Body Medicine, and today is a continuation of our series in mind-body practices. This is a 1-hour workshop on emotional freedom technique, and we will be led today by Dr. Kristin Jamieson. Dr. Jamieson is a graduate of our MBM Mind Body Medicine program at Saybrook, and she now teaches for us with us on an adjunct faculty basis. She is certified in emotional freedom technique as well as a whole host of mind body practices, and she is an amazing scholar as well. We welcome everyone here, whether you are with us live or listening to the recording, and I'm going to turn it over to Dr. Jamieson. You're on.
Thank you so much, Dr. Fortune. So my name is Kristin Jamieson. I am delighted to talk with you today about emotional freedom techniques. I have taught the energy medicine course at Saybrook, but as Dr. Fortune mentioned, I have been a teacher and practitioner of various forms of mind-body modalities for over 3 decades. I was trained in Tibetan energy medicine, later became a Reiki master. And I was so impressed with the research on emotional freedom techniques that I decided to also get certified in clinical EFT. So for our agenda today, I'll just lead us through a brief mindful moment. We'll get started into the history and principles of EFT, and we'll look into the research. I'll describe the basic tapping protocol, and then I will guide you through a brief self-administered self-care tapping session. So I'd like you to just begin breathing a little slower and deeper than you normally breathe. Feel free to close your eyes for just these brief few minutes, or you may have a soft focus at a space in front of you. And allow your awareness to rest on your breath and your body sensations. Noticing what you notice. There's no need to change what you become aware of. Just simply breathe with what you're noticing. And now I invite you to set an intention for our time together. Intention for maybe curiosity and a sense of being supported and a sense of compassion for yourselves and for the community that we gather in together. And allow your breath and your body awareness to support your intention of openness and compassion. And now on this last breath, I invite you to bring your awareness back to our group together, wherever you are. And welcome, everyone. So if you're able to share in the chat box and would like to, just wanted to invite you to describe your interest in emotional freedom techniques and how familiar are you with it? Just wanted to get a sense of the group here. And also feel free during the session to engage in the group chat, post reactions. Okay, thank you. See, we have some people familiar with EFT, some basic knowledge webinars. I've never used it with clients. Okay, great. Wanted to learn more. Okay, thank you. So emotional freedom techniques is a mind-body practice. It's evidence-based, and it's based on 3 main practices and principles. So it originates from an individual named Gary Craig, who compiled this series of techniques and protocols, but it's really based on the traditional Chinese medicine principles of acupressure in the choice of locations of where to tap. EFT is also referred to as tapping. Sometimes it's called meridian tapping. And it's also based in cognitive behavioral therapy and exposure therapy. So tapping works by stimulating the energy's meridian points by tapping them continuously to relieve physical and mental health conditions while cognitively focusing on specific issues. One of the aims is to energetically connect the acupoints and meridians, and in traditional Chinese medicine, it would be discussed as regulating the qi or the qi energy, regulating the blood and rebalancing yin and yang energies. So what is clinical EFT and why is there a difference? So there are several different types of EFT techniques, different practices that have evolved. Clinical EFT is the evidence-based method that's been validated in research studies that meet the APA standards. So it reflects the original protocol that was developed by Craig, and it's been standardized to create uniform application, research, training, and clinical practice. So clinical EFT does not require an individual to be a licensed clinician at this time. It is a certification program. It can take about 1.5 years. And it's called clinical because it's been validated as evidence-based and can be used reliably with clinical populations. So the American Psychological Association Division 12 Task Force on Empirically Validated Treatments determined that EFT is an evidence-based practice for a few things: anxiety, depression, phobias, and post-traumatic stress disorder. Now, it's important to note that there are actually 2 EFT acronyms that are in the therapy setting. The other is emotionally focused therapy. And this is a type of psychotherapy that is based on theories of adult attachment. So the types of people that may be clients or patients ranges greatly. There's lots of studies on cancer patients, pain patients, veterans, college students, people who are wanting to lose weight, athletes, healthcare workers, students of all ages. Let's see, I think I mentioned chemotherapy patients, people who have phobias. EFT can be safely practiced with children. The technique slightly differs than with adults, but it is also considered a gentle approach for children, and they tend to respond fairly quickly for different reasons, I think. And I see a message about a 16-year-old daughter. Thank you. Yes, a 16-year-old daughter with anxiety. This could be very helpful for her. So Some of the other conditions that EFT may be used for are weight loss and food cravings, skin problems such as psoriasis, chronic pain, dyslexia, sports and professional performance, and that includes academic performance, psychoneurological issues, diabetic sugar control, smoking cessation, alcohol cessation, pre-surgery anxiety, seizure disorders, fibromyalgia, insomnia, and also just increasing happiness and quality of life. So these are all topics that have been studied empirically, and there are also a large number of systematic reviews available. So I'm just going to briefly go over the overview of the practice, and we'll get into more detail with this a little bit later, but I wanted to give a sense of what the practice is for those that are unfamiliar with it. So this is generally a brief intervention type of modality. So 1 to 6 sessions is usually all that it takes to get significant results. In fact, some of the studies, as you'll see in just a moment, are only 6 weeks long with 1 session a week, and have lasting positive effects. So this is combining the elements of cognitive therapy, somatic stimulation of acupressure points on the face and just a couple on the body, and then exposure therapy. So participants begin by identifying a concern or an issue that they'd like to address, and then they rate their level of distress on a Likert scale of 0 to 10. So this is called the subjective unit of distress scale, and it's used widely in therapeutic settings. So then participants will state their concerns in what is called a setup statement. And this can assist them in tuning into their level of distress, especially when it's encouraged to tune into what the issue sensory qualities might be like, to make it feel a little bit more alive. What are the sounds that are associated with an issue? What's the visual cue that's associated with the issue? Is there any kind of taste involved as part of the memory? Is there a tactile sense? Is there a texture? Is there a scent associated with the issue? So the format is then to state, even though I have this problem or this issue, I deeply and completely accept myself. So the first half of the setup statement emphasizes the exposure and addresses the problem and faces that. And the second half frames the difficult event or the traumatizing event in the context of self-acceptance. So the patient then engages in the tapping process on acupoints on the body while they repeat a shortened phrase to stay engaged in it, such as feeling angry. So the shortened phrase is called a reminder phrase, and the tapping sequence uses to start off with 8 acupoints on the face and upper body, and then is repeated until the subjective unit of distress scale number decreases. And often just after 3 or 4 rounds of the tapping series, then the person will often feel like they're at a 1 or a 2 or maybe a 0. There are additional points that are tapped on the hand, and we'll be covering one of those, but not all the different ones. So here's a visual of what the tapping points are. It starts with the brow, and then so right kind of at the corner of the eyebrow on both sides, the side of the eye, right underneath the eye, and that bony prominence right under the nose, and then between the lower lip and the chin in the little divot area, the collarbone is the next area, and then under the arm there is a tapping point. And so you can tap on either side. People can tap with their non-dominant hand or their dominant hand. And then you can see that in the other image that these are connected to meridian points in the face, and they each have names. So I'm not going to go over a great deal of this slide, but you can see that each of these points is connected to, say, the stomach meridian, or the gallbladder meridian, the bladder meridian, small intestine. And each of those have different mental and emotional associations with them, like anger, resentment, fear of change, anxiety, emptiness. But also they can be associated with the movement of energy, the flow of energy, creating inner peace, emotional healing, clarity, compassion, understanding. So, the difficult emotions are thought of as what emerges when the energy is blocked, and the positive emotions are what emerges when the energy is flowing. So EFT Universe is one of the programs that offers certifications. There are several that people may choose from. They do a great job at posting updates of clinical studies as they get published. So right now on their website, they have 143 clinical studies that have been done on EFT. They have additional 63 clinical reports, and some of that has quantitative data about symptom scores for different populations, and then also descriptions of ways that practitioners can work with more unique populations, such as prisoners or refugees or abused children. There are a number of papers that look at the mechanisms of EFT and of energy psychology in general. And some of those mechanisms include the neurological theories, epigenetics, psychoneuroimmunology, and then hormonal pathways. There's also quite a few review articles and meta-analyses. And as of last year, there were an additional 91 research studies on EFT that were not identified in the Western databases because they are in different languages. So EFT is really used widely throughout the world. And some of those studies do use the clinical EFT protocol that was originally developed, and some of them have adapted it for different populations' needs. And so if somebody is looking into that research, that's something to watch for variation. So I'm going to go over just a few research articles to talk about some of the findings. So this study was looking at changes in the neural changes for chronic pain. So this was a small study. It had 24 adults, and they did an online 6-week EFT treatment group. They took functional MRI imaging, pre and post the intervention, and then they had 2 hours a week of didactics, so 30 to 60 minutes of psychoeducation, or other aspects of managing pain and understanding pain perception, and then 60 to 90 minutes of the EFT practice. This study used a number of inventories, such as the brief pain inventory short form, satisfaction with life scale, quality of life scale for pain, the general patient health questionnaire, and a happiness scale. Let's see, I think my slide is out of order. I'm so sorry. Let me just, there we go. So after the intervention, what they found from the functional MRIs was that there was decreased connectivity between the medial prefrontal cortex that modulates pain and the bilateral gray matter areas in the posterior cingulate cortex and the thalamus. So those areas modulate and they catastrophize pain. So they found that when those have decreased connectivity, the person is able to perceive decreased pain. And then in addition, the scales results showed that there were decreases in pain severity, pain interference, somatic symptoms, depression, anxiety. And there were also increases in the quality of life, satisfaction with life, and happiness. So the next study that I'll talk about is focused on weight loss, anxiety, and depression. And this is another pre-post outcome study designed with 72 participants. Again, this study was for 6 weeks. It was online, and weight was measured before and after, and 3 scales were used. The revised restraint scale, which identifies behaviors related to restraining eating, the power of food scale associated with the mental construct of food and reward, the hospital anxiety and depression scale that looks at anxiety and depression. So EFT was used to address a few areas that are related to emotional eating, such as binge eating, intermittent dieting, resistance to exercise. They also took a look at the different kinds of food triggers for emotional eating, such as being with people and maybe feeling like, oh, it's a time to celebrate. And so, so the emotional eating approach changes. Times of day can affect a person, the sense of reward, and then finally their own emotions. So after the study, 6 weeks was up, the results are that there was a almost 37% reduction in anxiety, 48.5% reduction in depression. The perceived power of food and the restraint behaviors also decreased significantly, and patients lost an average of almost 13 pounds during that 6-week program. So then at follow-up, at 6 months after the study, participants had lost on average another 2.6 pounds, and that the decreases that they experienced in anxiety and depression were maintained, even though the participants did not engage in further EFT practice. So this study was done through an app that delivered clinical EFT. The app is called the Tapping Solution, and this study gathered data between October 2018 and October 2019, in which over 270,000 individuals used this app. The different kinds of, we call them meditations, but the different kinds of tapping meditations were such that there were 12 of them that were associated with anxiety and 11 meditations that addressed stress. So these over 270,000 individuals completed over 380,000 app sessions with the 11-point subjective units of the stress scale. So, so their scale went from 0 to 10. And so for the results, the anxiety decreased from a mean score of 6.66 down to 3.75 for a 44% improvement. Stress also improved, just right about the same number at 45%. And these results are consistent when looking at results of EFT when it's offered to individuals in an in-person or person-to-person format. So this is news that can help those that are not able to perhaps schedule appointments with practitioners, or if they are not able to afford it, they can participate in this app through their phone. Okay. So I'll just talk briefly about the mechanisms of action. So in the brain, the changes that occur in the prefrontal cortex during the acute and chronic pain are altered by the neurotransmitters, gene expression, glial cells, and also neuroinflammation. The medial frontal cortex connectivity to the thalamus is related to the relay and modulation of pain. And it's also related to the spinal cord activity and awareness of nociceptive information, which is pain that's caused by damage to body tissue. So that connection is the theory is that the acupoint tapping can activate and deactivate these different kinds of signals, like the neurotransmitters and the gene expression, in the areas that are impacting the brain related to chronic pain. There are other mechanisms of action that have been proposed. One is that that EFT can interrupt the stress feedback loop so that it releases serotonin and endorphins, and then it decreases cortisol. It regulates stress via the hypothalamus pituitary adrenal axis and can improve immune responses and decrease inflammatory conditions. This is also related to limbic arousal that is thought to be dampened. So holding a difficult symptom or condition, which is part of the first part of the sentence, where somebody says, even though I feel whatever difficulty they're feeling, while also affirming and tapping, I completely love and accept myself. It's thought to cause the hippocampus to record the memory or the trigger, but without arousal. And so, so researchers think that the toggling back and forth of a moment touching in to something that is triggering, but then soothing it right away with the affirmation is what creates the dampening effect and also integration of an experience. So there's also other positive effects on the central nervous system through increased heart rate variability and improvements in the circulatory system through changes in the resting heart rate and blood pressure. And then finally, epigenetic changes are also theorized based on other data about psychological processes that create epigenetic changes. Okay, so start the practice of this technique, and I will again show you the image of where to tap in just a moment. So, so I'll ask each of you to consider a specific event to work on, something small, a mental or emotional block. This would not be the place for considering significant traumatic issues, that would be more appropriate for an individual session or work with a therapist. So what I'll ask you to do is to consider where in your body do you feel the emotional issue most strongly? Where does it live? What is its texture? Does it have a color? Does it have a sound? Does it have a scent or a taste? So I'll pause right here and just allow you to have a moment to think about something to work on. I will be presenting kind of a generic topic because we're a mixed group. So you can adapt what I'm saying to fit the idea that you're considering working on. My words may influence yours. And so anyway, you'll each have your own personal experience, even though I will be guiding a general practice. It is a good idea to be very specific in the event that you choose to work on or the feeling that you choose to work on. That can help create the positive experiences. And then finally, right now, determine the stress level that you have about this particular issue or event on a scale of 1 to 10, 0 to 10, where 10 is the maximum intensity and 0 is no intensity. And so what I would like you to do is to write that number down somewhere. This practice will be short, so if you don't have a pen, that's okay too. Likely you'll still remember it. And then what we will be doing is repeating the statement several times while we're continuing to tap on what's called the karate chop point on the hand. So I will show you that in a moment. And the statement is, even though I have, you name the problem or the issue or the consideration or the feeling, I deeply and completely accept myself. And we'll tap on different acupoints about 7 times, but it really can vary. 7 is about the minimum amount of time that you want to tap on an area, but it does not have to be only 7. And then I will be repeating a reminder phrase that you can then translate a little bit to fit your needs. And then after we run through the different acupoints, then we'll take a look at what your distress level is, and you can take note of that. And so then we repeat the process. So I'll show you this image one more time. And we do start with the eyebrow and then go to the side of the eye, underneath the eye, under the nose, the chin, the collarbone, under the arm, and then finally on the top of the head. So I'm going to just take down my screen for just a moment. And so the karate chop point is on this part of the hand here. And so, so this will be tapped here, and it's kind of just a light, it's not a heavy touch, just kind of like you're lightly pressing keyboards on a computer. The point for the eyebrow is at this, this curve right here. And typically we'd be doing it with both hands. And so since I'm holding my phone, I will just be using this one hand. So this would be the first place. The second place is just on the side of your eye here. The next area is on the bony area right below your eye. And then at the upper lip, on the chin, and then the the collarbone area here would be tapping. So it's okay to just use one hand as well. And again, it's okay to use your dominant or your non-dominant hand. And then finally, when I do the tapping on the side of my ribs, about 4 inches below my armpits, I like to cross my arms. It's a little bit easier to reach for the other side this way. And then finally, we do tapping on the top of the head. So I'm going to go back to sharing my screen just to show, let's see, no, maybe I won't share my screen. Okay, so if everybody wants to just consider an issue, the general topic that I was going to bring up with you today was just the topic of peace and wanting more peace in our lives or in the world or in my own personal mind, in the community, and considering that there could be lots of different issues that are hindering personal peace. And so I invite you to just begin tapping at this karate chop point here. And I'm going to be guiding the kind of the script that follows. And what you can do is you can actually repeat these out loud. It's most effective if you do repeat them out loud to yourself as I'm saying them. But of course, since we're all working on different topics, then you might need to translate what I'm saying into something that's going to work better for you. So I'm going to start with peace, and I'm going to be tapping. I really want to feel peace in my life. I really want to feel peace in the world. I want peace in my community. I want peace in my own mind. I want to feel restful in a peaceful place in my own mind. And I deeply and completely love and appreciate myself. I really want peace. And I'm really wanting this, even though I can feel that there's some areas of my life that I don't feel peace. And I choose to deeply and completely love and accept myself. Even when I know that I don't feel peace, I can completely love and accept myself. And I can accept that there's parts of me that would like to feel peaceful about certain topics. And I can completely love and accept myself. So now go to the bridge of the nose. Wanting peace. Wanting to feel peaceful. And I know that I'm not completely peaceful. I know that I'm not 100% peaceful. And I completely love and accept myself. And I deeply love and accept myself. Go to the side of the eye. And I accept the parts of me that don't feel peaceful right now. And as I'm tuning into wanting peace, I'm thinking about times when I feel peaceful and times when I don't feel peaceful. And I completely and deeply love and accept myself. And I still choose to want peace. Now go to just under your eye. This peace this piece that I sometimes don't have, this issue that I'm holding. I notice as I consider this that I'm thinking, I'm going to need to take an action regarding this. Go to your list. I'm not sure that's an action I'm ready to take. Maybe I'm okay with the level of peace that I have. To your chin. Considering wanting peace. Maybe it's more trouble than it's worth. Maybe I shouldn't. Maybe I just shouldn't say anything to anybody about trying to create better peace. I should just keep quiet about it. Your collarbone. Wanting to feel peace about different topics. Now, as I tune into that, I think I notice some fear. And that's okay. I deeply and completely love and accept myself and my fear. And I completely and deeply love and accept my desire for deep peace. Go to under your armpit. Fears. Well, I think I've lived with this fear for a long time. And I might live with it for a bit longer. And if I do, that's okay. I still deeply and completely love and accept myself. Now go to the top of the head. I think I'm starting to feel better already. I think I'm starting to see that I can hold my fear and I can still take action toward peace that I want in my life. Brow again. I think I'm getting new ideas about how I can be in the world, how I can communicate to people and in situations that I need to. And I can do that. And I still deeply and completely love and accept myself. I can have clarity around this issue while I deeply and completely love and accept myself. Go to under your eye. Peace. I'm starting to feel excited about creating that in my life now. Starting to feel excited about facing this issue that I wanted to have on the back burner. Yeah, I put it on the back burner. And that's okay. I deeply and completely love and accept myself. Yeah, I do feel more rested, feel more peaceful, just at the prospect of facing this issue to bring more peace in. Yeah, peace, action, and I deeply and completely love and accept myself. Okay, so pause here for just a few minutes, and I'd like you to tune in to the issue or the feeling that you are noticing in your body right now. How does the consideration feel? How does the challenge feel in you now? Where does it live in you? And just notice what you notice. And then what I'd like you to do is to consider what number on the intensity scale you are experiencing with it. And if you would like to, you could just put your first number and then your second number in the chat. Hey, a 7 down to a 3. Hey, great. So let's, in a tapping session, normally it would be about an hour, and we would go through the process a number of times. Thank you, an 8 to a 5. So let's just spend a few more minutes tapping on this issue, whatever it is for you, making sure that you are adapting my words to your own needs. So again, let's start tapping on the karate chop point. Even though I've felt some progress around this issue, I still feel the issues there. And even though I still feel that issue is there, and I've been tapping and learning this new process, I deeply and completely love and accept myself. And maybe I don't really know if it's going to get much better than this. And I can hold that thought and deeply and completely love and accept myself. Yeah, growth. Sometimes it doesn't really happen as fast as I want it to. And I'm aware that I want it to speed up. And I deeply and completely love and accept myself. Here. Oh, I think I can rest into that place of really loving myself, even though I want this growth to speed up. Or maybe I just don't really know how it's going to work out. So there's just some uncertainty. And I can hold that uncertainty. And I deeply and completely love and accept myself. And I'm also aware that that doesn't mean that I just accept the uncertainty, but I can accept my feelings about it. To the outside of your eye. This issue. This issue, I've struggled with this issue to some degree, or sometimes a lot, over time. And I deeply and completely love and accept myself. Underneath your eye. You know, I think sometimes I struggled when I didn't really need to struggle. And I can deeply and completely appreciate and love myself for struggling sometimes when maybe I didn't need to struggle. I think that there might be a way that I can breathe with the changes, maybe even breathe with the struggle. I wonder if that would transform it. And while I make space for that transformation, deeply and completely love and accept myself. struggle. Yeah, I think there's a different way of going about life. I think I can hold this issue with love and compassion, acceptance, while I deeply and completely love and accept myself. I bet I can even find actions that I might take that I can flow with and not struggle with while I find loving, compassionate ways to face issue, this concern. I think I'm ready for some clarity about this. And I think I've had some clarity. And I'm aware that this time together is coming to a close. And maybe I'm not completely resolved yet, but I can deeply and completely love and accept myself. I know that I don't have to work on everything all at once. I don't have to get better and healed and figure it all out all at once. Go to the side of my eye. I can rest in the peace and the growth that I've been doing just here, just for these few minutes. This can be a good place to rest. Ah, I can rest in peace. I am resting in peace and can be with an incompletion. And I deeply and completely love and accept myself. I think I'm even ready to just set this issue aside for the moment. I don't have to complete it in order to set it aside and feel like my process was complete to a point. Fortune. I understand that life is complex, it's complicated, there's lots that goes on. I can still tune into my joy and my peace while I understand that this issue is not quite complete yet. And as I tune into that, I deeply and completely love and accept. Wow, the wholeness of life, complexity, that is really a beautiful aspect. I think I'd be kind of bored if I had everything all figured out. Then go to your armpit. I can tap here, and I know that I can practice tapping in other times when I have more time available, and when I want to try to move some of this energy so that I have a practice that is really very simple. And I deeply and completely love and accept myself. Okay, so thank you for tapping along with me. I'd like you to just tune in to how you're feeling, how consideration is feeling, what are you noticing on that? What kind of sensations do you have? And then and choose a number that would reflect your level of intensity in the chat box. Okay. 5 to a 3, 8, 8 down to a 5. Thank you. Thanks for posting those. Okay. Well, thank you so much for your participation today in emotional freedom technique. Don't have a lot of time for comments, but if anybody wanted to email me, I'm happy to respond. Well,